moving on, you have a very interesting study with insulins and placebo and nocebo. I was wondering if you could go into that because that is actually quite clinically significant, and it's also not that well known compared to the other pain studies that we've done in nocebo. So I was wondering if you could go into in depth of how you were able to condition insulin responses in humans.
Yeah, so that's one actually of my favorite studies we've done. The idea was to bring our knowledge from placebo and conditioning to clinical practice and see, okay, we've done doing all the studies on healthy volunteers, but can we actually apply it to people who could benefit from that?
Mm-hmm.
And this study we used pharmacological conditioning, so what I referred to already before. And it's based on the previous research done in healthy humans, in which they show that healthy person, if you give them injection of insulin or intranasal insulin spray, both work for several days, several times, and then at a certain point you replace the insulin with a placebo. They found that in response to placebo, the blood glucose levels decreased and endogenous insulin levels increased. So basically, by such conditioning procedure, they could make the body respond to placebo as if it was real insulin. So that was a study done in beginning 2000s. And there was actually two studies, one with injection insulin and one with intranasal nasal insulin. So we took this idea and decided to see can we actually apply the same principle and look at patients with diabetes type 2. So for this study, we had two main groups. We had the groups of patients and we had a group of sex and age matched healthy controls. Because the idea behind that was we want to replicate, but we also want to know does it happen in patients if it happens in healthy volunteers, because it can be that it works in healthy people but doesn't work in patients. So we did the same. We had patients and healthy participants come into the lab. We gave them a nasal spray with insulin that had quite strong smell. So for 6 times, so they received 6 times nasal spray with insulin. Next
In
day
just
they
one
come back to
session.
the one session, but there was half an hour, yeah, between each of the
Okay.
spray administration. And we took blood. We took blood before and during the whole session. The next day they come back to the lab and we replace the insulin spray with a placebo spray, but it still has this strong smell. And people don't know that it's replaced. They are told you can replace, you can get insulin or you can get placebo. So we're just honest about that they can get either. But we don't say that first day you got this and second you got this. And we give them 6 times again the placebo spray, and we can measure their blood response. So we could not replicate the initial study in the findings that they found exactly. But what we found, the strongest effect that we found was actually in hunger. We found that our conditioned participants experienced actually less hunger after the placebo administration compared to non-conditioned one. And there is some research showing that insulin nasal spray can actually be used to decrease hunger. So basically, by being conditioned to the spray and even receiving the placebo spray, people experienced less hunger. So that was the largest effect. We also did find a small effect on the blood glucose levels, but the effect was quite small. So I don't want to overinterpret it. And it would not be clinically relevant. So it was statistically significant, but it was clinically not relevant. And it was both in our healthy volunteers and in patients with type 2 diabetes. And also, if I'm not mistaken, there was this significant effect was found only in males and not females. So it seems that there is again some role of sex. We don't know why. But then when I was looking back into previous studies, the most of research is being done in males, even though there is a lot of discussion in science now that we have to include both males and females. most of the insulin research has been done in males before. So it could be that our findings that we find effect in males and not females actually reflect what was before, but it's just previous studies were done only in males.
Mm-hmm. Okay, so I have a few questions about that. I guess the first one is, do we know if this is a very ignorant question, but do we know if the blood glucose levels in males and females are the same or are they different? Because maybe the drops
Uh,
could vary in that sense, right?
I think there is no big difference, so that should
Okay.
not matter.
Okay.
And the baseline wasn't different either, so we looked into that.
Okay. Okay. So, out of curiosity, how did you mask the insulin, like the placebo insulin nasal sprays?
So we worked with pharmacy. So we have pharmacy prepares every time for each of our studies. We have pharmacy that prepares our placebo with to mask it for the drug. Here in this study, there was a limitation that if you would compare the spray of real insulin with the spray of our placebo insulin, if you put them next to each other, they would differ a bit. And unfortunately, it was really impossible. We tried to make them exactly identical. We managed to do it in our oxytocin previous study. They were identical. With insulin, it didn't work out. They didn't have one of the elements that was in insulin for our placebo group. However, to control for that, we asked people what did they think they received, and we asked if they smell difference, and no one could see the difference because it's given on 2 different days, so people probably forget. But
Okay.
we were worried about that for sure.
Okay. And in terms of experiencing placebo effects, would the injection of insulin or its placebo give a stronger response than an intranasal, I guess, spray?
I think that could be another like critical point of the study is that intranasal spray has very small effects, and we don't know if the real injection would matter, but I think so because injection is a very strong stimulus, and also getting insulin right in your blood causes the effects immediately, and that was the reason
Right.
also why, yes, because it's immediately in the blood. From the
Mm-hmm.
nose it takes time to get into the blood, so that's why we did it 6 times within one session because it takes time to accumulate.
Yeah.
Yeah, but
Okay.
basically we had mostly the ethical reasons not to do insulin injection because people with diabetes they might respond to injection quite with severe side effects. You can get into hypoglycemia, very low
Mm.
blood sugar levels, and that can be really bad. So people
Yeah.
can lose consciousness,
Yeah.
and so that was the reason we went for a safer option.